Kia ora and welcome to the Southland Hospital Radiology videos. These videos have been created to help people know what to expect for their next visit to the radiology department.
If you're an outpatient, you will receive your appointment by letter. Please read this carefully as you may need to confirm your appointment. If you're unable to make your appointment, please ring the contact number on your letter and let us know. There is free parking available at Southland Hospital, although it can get very busy at times. Please allow yourself plenty of time to find a car park. If the main car parks are full, there is an unsealed car park behind the main building, but allow a few extra minutes to walk from there. For your outpatient appointment, you will find us on the ground floor of the hospital. From the main entrance, we're the first apartment on the right after the gift shop. When you arrive, please check in at our reception. Remember to bring your appointment letter with you to show our reception staff. They will tell you where to wait and give you a gown if you need to get changed. Southland Hospital offers patients attending appointments free Wi-Fi, which can be accessed by joining the network under your phone settings. Bathroom facilities are available within the department. Please ask a staff member for location. In the event of an emergency, follow instructions from radiology staff.
This video has been made to assist you and your family understand the process of a PICC line insertion in the radiology fluoroscopy unit.
If you are an inpatient, an orderly will collect you from your ward and bring you to the radiology department. You should have received a copy of the patient information PICC booklet to read prior to your appointment. A PICC line is a tube that is inserted through your skin into your upper arm using ultrasound. On arrival to the fluoroscopy room, you will be greeted by the nurse who is specially trained in inserting PICC lines. Qualified medical imaging technologists, or MITs, and student MITs completing their medical imaging degree will assist during your PICC examination. All student MITs are always under the supervision of a qualified staff member. Their role is to perform imaging using the fluoroscopy machine. The nurse will get you changed into a hospital gown and ask a series of questions such as, who is your GP? Who is your next of kin? And do you have any allergies to medicines or dressings? You will also be asked if you have any other relevant medical history, for example, a pacemaker or shoulder problems. We will also record your height. Please ask any questions prior to signing the consent form for the procedure. In the room, you will be on the bed and a board will be placed under your shoulder for support. The nurse will look at your veins with an ultrasound machine, which uses sound to identify a suitable vein. Once this is identified, the nurse will scrub in a sterile gown and gloves. They will then drape your arm. The drape will be laid over your shoulder and upper arm. This is a sterile or clean area. The nurse will use ultrasound to insert a cannula, similar to an IV line, and inject local anesthetic, numbing the area just under the skin. A wire is placed through this cannula and the vein is dilated. You may feel slight discomfort at this stage before the PICC line is inserted. Once the PICC is in the correct position, we use the fluoro machine to take an image. This machine will come very close to your face but will not touch you. Radiology staff will check the image to ensure the PICC line is located in the right place. The radiologist, a doctor that specializes in reading x-rays, will make the final check. Following this, a secure cath device will be used to hold the catheter in place and prevent movement. A dressing is then applied to provide further protection. The nurse will complete your paperwork and instructions are given to you on how to care for your new PICC line. You will need to keep your PICC line dry when you are showering. PICC lines can stay in for a year or longer depending on the length of your treatment, so it is important that we look after it. The district nurses or hospital ward nurses will monitor and observe your catheter for the length of time that the PICC is required. If you're an outpatient, this will be arranged for you before you leave the hospital. The radiology nurse will send a referral onto the district nurses, and if you're an inpatient, the information will be written in your medical notes for the nursing staff on the ward to arrange follow-up.
Radiology staff want your visit to be as pleasant as possible. If you have any further questions, you can ring the department on the contact number given in your appointment letter. We hope this video has provided you with some useful information about PICC lines. We look forward to seeing you. Haere rā.